Hello, everyone, and thank you for joining us today, and welcome to the LASIK webinar here provided by Dakota Eye Institute and performed here by Dr. Paul Seled, our resident LASIK surgeon. Just a little background on Dr. Seled here. Grew up in Williston, North Dakota, and went to the University of North Dakota School of Medicine. So a local guy here, and we're going to go ahead and talk about LASIK, what LASIK corrects, what the process looks like, and really what it means to you as a patient as you're walking through the LASIK process and learning about it, and figuring out if this is a solution that can help you get rid of those contacts and glasses. So a couple administrative notes here. In the right-hand side of that go-to webinar box, you will see a field that says questions. If you have any questions throughout the presentation here, feel free to write those in that box. And at the end here, I'll go ahead and read off all of those questions to Dr. Seled, and he'll take the time to go ahead and answer those and work through those questions and make sure anything that you guys have is answered and taken care of. And other than that, I'm going to pass it over to Dr. Seled, and we're going to learn a little bit about LASIK. So let us know if you have any questions, and we'll answer those here at the end. So on over to you, Dr. Seled.
Thank you, Josh, for the kind introduction, and thank you all to joining me for this LASIK webinar. My name is Paul Seled, and I'm an ophthalmologist surgeon at Dakota Eye Institute. And as a team, we perform LASIK and PRK surgeries here. Today, we're going to talk about LASIK, PRK, and how these procedures might benefit you, why we do them, some of the risks of the procedure, and we'll go over that in good detail, what makes a good candidate, the procedure itself at Dakota Eye, and we do have some video to accompany that so that you can feel most comfortable with this. So I thank you for joining. I know you must have some interest in LASIK if you're joining this webinar, and my goal here is to be as informative, educational, and concise as possible so that we're all best using your time. So LASIK is a very big deal. I understand that, and the whole team at Dakota Eye Institute, we understand that any procedure with your eye, including LASIK or PRK, is something that you need to think a lot about, and you have many questions that present to you when you're thinking about this. Things are like, does LASIK hurt? Am I going to go blind? Can I afford LASIK? Why do we do LASIK? Am I a good candidate for LASIK? And a few other things. So I'm going to try and address those as best and thoroughly as I can during this presentation so that you have some more comfort with LASIK at Dakota Eye Institute. LASIK is used to treat vision problems, and this vision problem is refractive error. Typically, refractive error, we classify it into three large varieties. The first is called nearsightedness and is the most common. We also call this myopia. Typically, this is because the eye is too long or the cornea is too steep. So we're not able to make the eye shorter, but we can make the cornea flatter. And that's what LASIK and PRK can do, is they can make the cornea flatter, which can correct your nearsightedness. People with nearsightedness are those that see usually pretty well up close without glasses or contacts, but they need glasses or contacts to see well into the distance. Nearsightedness would be the most common reason that people present for LASIK. The second type of refractive error is called farsightedness or hyperopia. These are patients that see a little better in the distance, but they struggle to see well up close. The eye in this case is just a little too small, or the cornea is a little too flat. So just like we can't make the eye shorter, but we can make the cornea more steeper. Or just like we can't make the eye longer, as in treating of nearsightedness, we can't change the length dimensions of the eye, but we can change the steepness and flatness of the cornea. So with farsighted LASIK, we basically just make the cornea steeper, and we can think of it as putting your glasses or contact lens prescription into your cornea permanently. The third type is called astigmatism, and these patients typically don't see very well at distance or near. And this is usually because the cornea has a shape that's more like a football than a basketball. So it has a steep and a flat meridian. And kind of like farsighted and nearsighted LASIK, astigmatism-based LASIK can correct that football shaped cornea and make it more basketball shaped so that you can see well. You can have nearsightedness and astigmatism or farsightedness and astigmatism and still do very well with LASIK. And that's actually the most common way that patients present. So all three are very common. Astigmatism is very common, and all three are very likely correctable by LASIK. So one thing I will tell you is LASIK at Dakota Eye Institute is custom LASIK. LASIK has been around since 1998 and approved by the FDA. People were doing it in 1998 and since then, and it's really only become more popular, and the technology has only gotten better. That's really encouraging because it can tell you as a patient interested in LASIK that LASIK is not a gimmick. It has withstood the test of time, and I will tell you that of all my patients that I do surgery on and treat, the LASIK patients are very likely the most happy patients that I see. So that's the big reason why I do LASIK, is because these are very, very happy patients that come out after LASIK. It's really a life-changing procedure. And at Dakota Eye, we do custom LASIK. So in 1998, there was no such thing as custom LASIK, but as the technology has evolved, it's become custom. What that means to you is your individual eye prescription is being treated as an individual eye. We're treating more than just the nearsightedness and the astigmatism. We're treating things that are conceptually called higher order aberrations, and we can really pinpoint that refractive error to your eye. Just like you have a unique fingerprint, your eye has a unique refraction. And with custom LASIK, we're really treating you as an individual in your eye to get the best vision possible. So that's what you're getting here at Dakota Eye Institute, is custom LASIK. And that's really exciting because that can give you the best vision possible. So LASIK, there's three big steps that we do. The first is create a cornea flap. And the cornea flap is really what makes LASIK LASIK. So historically, this was done with a microkeratome blade, but since then, femtosecond lasers have been developed, and that is what all laser LASIK means. So it means we use one laser called a femtosecond laser to create a cornea flap, and a second laser to reshape the cornea. So once we make that flap, we lift it up and we reshape the cornea using the custom excimer laser to reshape the tissue based on your custom wave scan or eye design wavefront guided image that we do in clinic. And then we simply put the flap back. None of these procedures are painful, and they're all very safe and very, very well proven. So with custom LASIK, many patients reach 20/20 vision, but some will even reach 20/15 or better vision, which is encouraging because we all want really good vision. It's so important to us. As I said before, traditional LASIK used a microkeratome flap, which was more of a sharp mechanical device. Bladeless LASIK, or all laser LASIK, means we use the femtosecond laser. And I will show you a picture of me performing LASIK using the femtosecond and the excimer laser. I and many other refractive surgeons across the country really appreciate the femtosecond laser because it gives us perfect centration of the cornea flap on your eye. It gives us very precise depths of the cornea flap and other favorable factors over the microkeratome. All of that together to you should mean safer LASIK and better vision. At Dakota Eye Institute, we have the Johnson & Johnson Intralace femtosecond laser, which makes the flap. And then we have the Johnson & Johnson Vizx Star S4 excimer laser. Both of these are state-of-the-art laser systems and are at the forefront of the industry so that you aren't getting second-rate technology or second-rate LASIK. This is as good as you can get it. So that is kind of the rough overview of LASIK. Now I'm going to try and address some of those questions I told you I would earlier, such as the risk, are you a candidate, what can LASIK actually do? One thing I will tell you with the LASIK process at Dakota Eye Institute is you will see me every step of the way, before, during your procedure, and afterwards. You'll have face-to-face meetings with me where we can figure out if you're a candidate. I will plan your treatment, I will do your procedure, and I will see you post-operatively. You will also have other point contacts at Dakota Eye so that you have your person to guide you through the process. So risks are really a big question, and we're not going to try and minimize those. We'll tell you that LASIK is very, very safe. And one point I really want you to know is contact lens use is much, much more risky than performing LASIK. And other cornea and refractive surgeons across the country would overwhelmingly agree with that statement. Contacts can cause problems. They do a lot of good, but they can cause problems. And I will tell you that LASIK is much safer than lifetime use of contact lenses. Two things will happen with LASIK that are for sure that I tell every patient. One is your eyes are going to feel dry, and that's very normal and that's expected. You will use artificial tears to help with that. In some patients, it's only a few days or a few weeks that it's a problem. Some people it lasts longer, but almost for sure within 6 months, your eye is healed up and your tear production is back to baseline, and that's okay. But we just have to know your eyes will feel dry. You will notice a change in glare, halos, starbursts. Every eye in the world, whether it's had LASIK or not, will have glare, halos, and starbursts, and it will probably be better after LASIK, but it will still be there. It will be better because of that custom technology that we use. We also have a small risk of over or under correction with LASIK. So what that means is you have a prescription that we're trying to treat, and we can overshoot that or undershoot that prescription. And if we do that, if that happens, we will do an enhancement free of charge, and that's a painless procedure. Sometimes you'll need glasses and contacts after surgery, and we'll talk a little bit about why you might need that in the coming slides. Infections, structural problems, and other flap-related complications can happen, but the risk is very, very low, and I can manage those post-operatively. And the last statement there, most complications are extremely rare and almost all easily corrected is very true. So can you get out of your glasses? I would say in almost the vast majority of cases, you can. The big concern becomes when you get to be 45 years and older, you lose the ability to focus, and we call that presbyopia. That's why you see 45, 50, 60-year-olds stretch their arms out more to see smaller print. This is something that LASIK does not cause. It does not make it happen faster. It happens whether you have LASIK, ERK, or not, or you don't. It'll happen at the same rate at the same time. So one option is you just wear reading glasses, or one option that LASIK can do is called monovision. And monovision's been around as an optical concept for many, many years. And it's where one eye, typically the dominant eye, is focused in the distance, and the non-dominant eye is focused up close. There are a few trade-offs to that, but the big benefit is you can live your life seeing things up close, in the middle, and far away with no glasses. So that is a way around needing reading glasses with LASIK. And that's something that I would discuss with you in person if you presented for LASIK consultation in your 40s, 50s, or 60s. Other eye conditions can develop. The most common would be cataracts, but that's not something that typically develops until you're in your 60s or 70s. Why LASIK is so popular is because it's so fast to good vision without side effects. You can typically return to work the next day. So we do LASIK and I'll see you the next day. Most of my patients drive to the appointment the next day because they can see and their eyes feel fine. There's a few restrictions we'll talk about afterwards, but overall, you can get back to your job the day after or the next day after in most indications. So it's really friendly to people that have kids, that work, and that just have activities that can't be paused. So another big question is, am I a candidate? Well, we'll go over the details of this right now. 18 years of age and older is dictated by the FDA to be a candidate for LASIK. So you need to be 18 years of age or older. You need to have a stable glasses prescription over the course of a year. We don't want to have somebody who has a changing glasses prescription because that could mean something else is going on. We usually define that as about a half diopter of change in your prescription in the last year, and your optometrist can help you with that decision. We want you to have a healthy eye outside of the refractive error that we talked about before. So we wouldn't want you to have cataracts or other problems with your eye if we are considering LASIK. And then just in general, you need to be in overall good health. We used to think that having diabetes and other medical conditions would be an absolute prohibitive reason for doing LASIK, but that's not really the case anymore. You can have diabetes and rheumatoid arthritis and thyroid problems and other problems. As long as they're medically controlled, they're stable, it's very reasonable to do LASIK, and I can help you with that. So the way we do this at Dakota Eye Institute is free LASIK screenings. So what this is it's you come see me, we do a few tests, and we say, are you a candidate or are you not a candidate for LASIK? That's the only question we're trying to answer. To do that, I'll examine your eyes, I'll look at your refractive error, and we'll do a measurement of your cornea thickness, cornea shape, and cornea curvature. And all that information together, I can tell you if you're a candidate for LASIK, NPRK, or PRK only, or none of the above. And that's a no pressure, no sales pitch visit with me. It won't cost you any money, and that gives you a lot of information. One thing that's a very strong point at Dakota Eye Institute is I think we do a very good job at screening patients. The first thing is we don't want to do any harm. So I'm very picky about who we select to do LASIK on because I want good results and no problems. So we have the state-of-the-art equipment to measure your cornea shape and dimensions so that we can do this as safely as possible. The other thing that commonly comes up is you cannot be pregnant or actively breastfeeding and have LASIK. And that is just because your prescription changes when you're pregnant or breastfeeding, and we would want to wait at least 3 months following that to get stable prescriptions before we would consider doing LASIK. The next step is a little bit more involved, and that's called a preoperative evaluation. This is the second step, and this is when we went through the LASIK screen and we said, yes, you're a candidate. So then we do an evaluation. This is really where we put in the work for LASIK. We do a scan that's called a wavefront guided image, and that's where we get the picture of your eye to do custom LASIK. That's a really important scan because I take that information and I put it into the laser, and then the laser does the custom treatment for you. So we want that scan to be really good. I'll double check that scan with something called a cycloplegic refraction, and that's basically me making sure the numbers all make sense. And if they're not making sense, we're going to take the time to figure it out. We also dilate your eye at that appointment, do a full eye exam, check your eye pressure, and talk about the risk benefits alternatives to LASIK. This appointment, this is the one where you would need to be out of contact lenses for at least 2 weeks before performing the pictures. Then the best day is the surgery day. So this is when you show up to the surgery center, you're not wearing makeup. If you're a little anxious or even if you're feeling calm, you'll get a little relaxing medicine to help you. Then we meet in the LASIK suite. You lay down on a table and I talk you through about the 5 to 10 minute per eye procedure, which is painless, and you'll get up off the table and you'll be able to see well. And then I check your flaps when we're done, the LASIK flaps, to make sure they're healed, and then you get to go home and rest. So here's a video that's about 2 minutes long of us doing LASIK at Dakota Eye Institute. And I will narrate you through this. This is our patient who's coming into the room. She's laying on a mobile bed that's going to be able to swing between the 2 lasers, and something to keep the hands busy during this process. You'll have 4x4 gauze tucked around your ears, so no drops get into your ears. Your eye gets numbed, and the first step of LASIK is to make the flap. So this is the most stimulating step, but it's not painful. What the patient feels during this process is pressure, and sometimes the vision changes a little bit, but it's all very expected. All I'm doing here is placing a suction ring under the upper and lower lid, and there's just a little bit of pressure, not much at all. And then at this point, we have ability to control your eye, so you do not have to worry about moving your eye or looking in the wrong direction. I'm in control here. I'm talking to you. Everything's really relaxed. And then you move over under the laser called the femtosecond that makes the flap. that cone-shaped light just comes down to your eye. There's no more pressure or anything here. It just touches your eye, and then we're in full control, and we spend 20 seconds creating the flap here, which is completely painless. You don't even know what's happening. I'm the only one that knows what's happening at this point. And then once we're done, we release that pressure. You slide over to the first laser that you started at. We put an eyelid opener in so you don't have to worry about blinking. I lift your flap up, apply another second laser that's painless, put the flap back, take the eyelid opener out, and that's it. At this point, you can sit up and you see well. Every patient that has LASIK will tell you that it's not painful. It's an unusual feeling, but it is not painful. Post-operatively, there are some instructions, and we take these seriously. The big ones are you have to use your drops. We don't want you to rub your eye. You'll wear sleeping goggles for 1 week, and that's just because we want those flaps to heal as perfectly as possible. And then no underwater activity like hot tubs, swimming pools, lakes for 2 weeks, and that's another very important one. Post-operatively, I see you the day after, the week after, the month after, and possibly longer. But if we're both happy at 1 month, we can leave visits to as needed. And that's most often the case. At Dakota Eye, we charge $2,100 per eye for custom blade-free LASIK and $1,800 per eye for PRK. This includes everything before, during, and after your procedure. So there are no hidden costs. It includes all the pictures, images. That includes your post-operative care and enhancements for 2 years. We have financing options available, and we will take care of you as best as you can. You get free designer sunglasses, up to $200 from our optical shop. So if you have any questions, I hope you've been able to type them in, and I would be happy to answer any questions. I'm so happy you joined us for this on this very nice Friday, where we have a nice weekend that we get to look forward to.
Absolutely. We will take the nice weather, I know.
Absolutely.
So absolutely, guys. So just as a reminder, on the GoToWebinar option there, you'll see a place to ask questions. We've got a couple in there, you know, as we're going through here. So I'm going to answer those, but feel free to add those questions as we go through. It's for sure not too late. So the first question that I have here is in regard to payments. Will there be any down payments for this procedure, or are the payments due, you know, upon scheduling? What does that look like?
There's a down payment of $200 at the time of the second procedure, at the time of the evaluation, and then the remainder is due. If you're having both eyes, it's $4,200 total. If it's one eye, it would be $2,100 total, but a down payment of $200 at the time of the evaluation. The screen again is completely free.
And then that down payment, of course, would go to the total cost of the procedure there.
Absolutely. Yep.
Yeah. So what happens if my results aren't, you know, quite, you know, what I expected? I know, you know, everybody thinks, you know, going into it, I've done my research, I've, you know, I'm excited for LASIK, but if I come in and there's something that's, you know, amiss in my measurements, you know, what are my options with you guys specifically at Dakota Eye Institute if there are some issues there?
Well, the issues are rare. Enhancements are something we talked a little bit about, and they're usually about 5 to 10% of patients, just all comers that need an enhancement. So it's very common to have that. I mean, it's not uncommon to have that happen, and we'll take care of you and do an enhancement free of charge within 2 years of your LASIK procedure. And that is if, you know, there's prescription left if we didn't hit our target right away. If you're bothered by other problems that aren't vision related, like your eyes feel dry, we will definitely take you and treat those problems until we get you to the happiest and safest spot possible.
Awesome. And then if I've had cataract surgery, am I still a candidate for LASIK?
Yeah, that's a great question, and the answer is yes. So LASIK treats refractive error. And if you've had cataract surgery and there's a refractive error that we can correct that would make you happier, we can certainly do LASIK or PRK for you in that instance. Some of the technical aspects that are really only on my end change, but that is something we can very easily and commonly we do accommodate that.
Great. And if I were, bifocals or progressive lenses, rigid gas permeable contact lenses, are there any issues for a patient that would be utilizing some of those visual aids in terms of getting LASIK?
Nope, you can be wearing RGP contacts, you can wear multifocal contacts, bifocal contacts, all of those. Contacts, the reason we want you out of contacts before we do all the measurements is they can change the shape of that cornea that we talked about at the beginning. And obviously we want your original cornea shape before we do any measurements. So we might do measurements a few times to make sure we're getting accuracy and precision in those measurements so that we're going to give you the best treatment possible. So RGPs are hard contact lenses. Not many people wear them anymore, but if you're wearing those, you might have to be out of contacts for several weeks or even several months before we can get stable measurements. And I'll help you through all of that.
Great. And then can you just kind of highlight the results right after LASIK in my vision? What should I expect to see immediately following, the day after, the week after? Is LASIK something that is an immediate kind of gratification where I can sit up from the procedure and immediately see better than I was prior? What does that look like over the course of healing and post surgery?
Yeah, right after LASIK, when you stand up from the chair, you will be able to see better than before you came in the room. It'll be a little bit like looking underwater type of vision, but it clears up as the day goes on. And the next day, I would say the vast majority of patients are seeing 20/20, 20/15, 20/25 on the chart the next day. And the things that are usually prohibitive of the day one after LASIK vision are usually just normal dry eye changes that resolve in a couple days. So very likely to be 20/20 the next day, and the next week, very likely to be 20/20 with just a little bit crisper vision and a little bit more comfortable eye. But as I said before, most patients drive themselves to LASIK post-operative appointments, even the day one appointment. PRK is the procedure I mentioned a little bit in conjunction with LASIK, and I consider them to be cousin procedures. PRK stands for photorefractive keratectomy, and it's actually been around longer than LASIK, and it's still done very frequently. Many people that told you they had LASIK may have actually had PRK, and there's different reasons for doing PRK over LASIK. One is if your cornea is a little too thin or there's some scars on your cornea, or some people just choose that they want to do PRK. The thing with PRK and why it might not be quite as popular is because it doesn't heal quite as fast as LASIK. Right? The minute after you get PRK, you can see much better, but it'll be a little blurry for a few days, few weeks, and sometimes it can take up to 1 to 3 months to get your final vision. So you will be functional. You'll be driving a few days after PRK, or 3 or 4 days after PRK. You'll be living the life, doing almost everything you normally do, but it's just not quite as fast a recovery as LASIK. And it does come with some pain. And I mentioned that LASIK is pain-free. PRK patients, some of them do have some pain and need some downtime afterwards.
Great, and I have a question here. How close does the consultation, screening, evaluation, how close does that need to be done to the actual procedure date? So if I were to go in and get deemed a candidate and went through the dilated exam, how long after do I have to schedule my procedure before those results may be in need of a reevaluation?
We like them to be within a month. It can be a few days before, but the recommendation I would have is to do that about a month, or no longer than a month before your actual procedure. And we can help you to schedule that and get the timing worked out so it works for your life.
And in regards to insurance and the different insurance coverages the patients may have there, would they call your office to see if there is any insurance coverage for LASIK or anything that you would know about that off the top of your head?
Yes, absolutely. We have a point person here at Dakota Eye to answer all those questions, so you don't have to rummage around through different people trying to find the right person at Dakota Eye. You'll have a contact person that can help to answer all those questions for you.
Great. And the next question I have here is, what types of eye disease would preclude me from being a candidate for LASIK, things like glaucoma, et cetera?
Could you repeat that question, Josh?
What types of eye disease would preclude me from being a candidate for LASIK? So what ones may, make it so LASIK wouldn't be a possibility for me? Glaucoma would be the example given in the question, anything like that.
Glaucoma, LASIK does not cause glaucoma. It does not make glaucoma worse. But if you had severe glaucoma or moderate glaucoma, I would tell you, and we would not do the procedure in most instances. Cornea scars, so that can be from like an infection related to maybe a contact lens in the past, would be prohibitive, or trauma to the eye can create cornea scars. Cataracts, keratoconus, very severe dry eye that's not amenable to prior treatments. Those would all be contraindications to do LASIK, and I will definitely help you with that at our LASIK screening to make sure you are not put down the wrong track.
And I have another question here that, you had mentioned that pregnancy can affect a person's eyes. Do you recommend that someone not consider getting LASIK eye surgery until they're done having kids? I think the question would be, if I'm looking to have kids, should I get the procedure now, and will I be okay having kids then, or do I have to wait until I'm done having kids until I have the procedure?
Nope, great question. You can have LASIK before you have kids, and then or after you're having kids, or in between kids. As long as we're having stable prescriptions, that is very, very acceptable to do LASIK before, in between, or after kids. Pregnancy is basically hormonal changes, and hormonal changes change the refractive state of the eye. So that's a transient thing. So we're always going to come back to baseline. So you're always going to get that good LASIK vision if you had LASIK before kids. Sometimes when you're pregnant, you can notice the vision gets a little blurrier, and that's because of that refractive change, but it should all drift back towards normal.
Great. And I guess the last piece that I would have here, for the people that are listening here, if they're, excited about LASIK, calling your office and scheduling that LASIK screening would be the first step with them, and any guidance you would, put onto these patients if they do want to start determining if they're a candidate and taking these next steps. Any pieces you'd like to add with that?
Well, I think, the big first step is to just call in and let us know if you're interested. All you have to do is you just show up, and we'll schedule you to see me, and we'll go through the best scans and figure out if you're a candidate. And I can just tell you at that appointment any specific questions you have, and try and make you feel comfortable with the whole process. And that's my whole goal. I want happy patients. I want you to feel really comfortable with the process. I want you to tell your friends and family you had a good experience here. And that's the whole goal. And we'll do whatever we can to make sure that we achieve those goals. If you have direct questions, you can call our LASIK coordinator at our direct number, which I don't see on the screen, but that's 701-354-0329, and you can talk directly, get directly to the LASIK coordinator.
Awesome. And then you did highlight one thing in there. I just want to make sure, because I think for patients it's important to know that you don't always have a LASIK surgeon that's there in your community, preoperatively, postoperatively, and there for every step of the way. And Dr. Seled, I know that's for you something that's really important, is that you're with the patient, from the get-go, starting the screening all the way through the 1 day, 1 week post-op, and you also live, in the community. And so if there's ever any, issues or things that need to be addressed, pre or post procedure, you're always there and you're always available. You're not flying in from somewhere else to perform the procedure.
That's correct. I live here. I'm here every day. I see other patients outside of LASIK and refractive patients, and I can take care of you if there's any issues arise. The other great thing about Dakota Eye Institute is, you know, we're small. We can make changes when changes need to be made, and we're not bound to the corporate structure and other standards that we can't always do what's right for the patient. We can figure it out here.
Great. And then I have one more question here from one of our attendees. What range of vision do you treat? You know, is there a high end of a prescription, you know, low end of a prescription where, you know, it's outside the range of being treatable with LASIK?
Yep, there is a range, and that's really dictated by the FDA and saying what we can do. So studies were done to figure out what LASIK can do and what's safe, and those boundaries are determined by the FDA. We treat up to about 3 diopters of farsightedness. In some cases, we can treat up to 5 diopters of astigmatism. In the nearsightedness, it can be up to 10 diopters or even more of nearsightedness. But that all kind of depends upon different parameters of your cornea shape and thickness. And remember, the first goal is to do no harm. So we're going to work within the context of all of that to figure out what's right.
Excellent. And so I think that just about wraps up the questions from the attendees here. You know, is there anything else you want to add in, Dr. Sellett? If not, we give everybody permission to leave work early and go enjoy this nice weekend.
Have a great weekend, and thank you for your interest in LASIK at Dakota Eye.
All right, thank you, everybody. And just as an announcement here, we do have this webinar being recorded. We will send this out to you via an email. So if you have friends, family, you know, that you want to share this with, or if you just want to rewatch it again to capture any information, we'll be sending that email out to you. We thank you guys so much for attending today. If you do want to find out if you're a candidate, the number is on the screen there. Of course, you can go to our website and follow the steps through there to schedule an appointment or call us. But we sure look forward to meeting with you and hope we were able to answer some questions that you guys had today. And if there was anything that you didn't get to ask or that you want to learn more about, just feel free to give us a call, and we're always here to help. So thanks so much, guys. Have a great Friday, and we hopefully will see you soon.
Thank you, Josh, and everybody.
Take care.